On the flip side, what do you think are some of the most rewarding parts of patient education, nurse ambassador?
So the bonds you form with certain patients are truly great. I feel like I've, made connections with certain patients. So when it was time to graduate them or transition them out of the program, it was a tough conversation for both of us because, I would really enjoy their conversations and talking to them and seeing their progress. For example, I had one patient who basically was just bedridden with pain and getting around in a wheelchair, and a younger patient. And once they started the medication and a couple months into it, they were walking around without even a cane or a walker. They were able to play sports again. So that is a very humbling part of the job, is seeing that this medication actually, can work and does work, and it changes patients' lives. So yeah,
I think there is something to be said about being able to watch a patient through, over like a longer period of time and seeing progression, or, seeing how the medication is working. Because you don't have that in the hospital, like as soon as they get to a point where they're medically ready to leave, then they leave. It doesn't mean that they're better. It doesn't mean that they're, long-term isn't going to, affect them. So like having that kind of long, I don't want to say cohort, but like over time.
Yeah, like the longevity of the relationships is great. Yeah. Seeing their progress and
seeing like full circle moments.
Right. That's awesome. And then I did always love when I would call a patient and they'd answer without even anything. Hey, Carlisle, like, how's it going? What's up? So it is like you truly do form a relationship with these patients, and just empowering them is a really empowering experience for yourself as well. So
I know when we start patients out with like injectable medications, I mean, more often than not, nobody wants to stab themselves.
Right.
It's always like a anxiety provoking thing the first time, if it's insulin or Lovenox, like I said, or, so probably getting them over that hump and like helping them through that, and then seeing how independent they become at it. And I'm sure that that's very satisfying.
Absolutely. It's funny. Some of the, patient injection training stories I have, patients would, be so scared. Like I could see them physically shaking when they were holding this pen or syringe. And, I think the longest injection training I had was a little over 2 hours, because this patient was just so afraid to self-inject. And, we got his mind off certain things, and we're like, okay, let's talk about this for a little bit. Let's, do this. And finally, when it came time, he did it, and he just started profusely crying. And I was like, oh my gosh, what's wrong? He's like, I didn't do it right. And, we walked through the process close to 10 times. I'm like, there's no way you didn't do it right. And I made him show me on camera the whole injection site and the pen. I was like, no, you did it right. You just didn't feel it, because the gauge of the needle is truly so small.
Little, yeah. Those pens, they're tiny.
Right. So he was like, wait, so I kept you on FaceTime for close to 2 hours for that? You did, but I'm happy to do it.
I mean, your imagination is so powerful, right? Because that pen is like this long, and he probably thinks the needle is like this long or something.
Right, yeah.
It's like, it's really like, I don't know.
It is nothing. He was like, I don't even think I see blood. And I was like, some patients don't even draw blood. So, yeah.